One of the biggest challenges facing healthcare systems globally is the growing wait time for outpatient specialist appointments. In many countries, patients wait months or even years to be seen. However, most waiting lists are prioritized using information collected at the time of referral and are rarely updated. As a result, patients whose conditions deteriorate while waiting may not receive timely care, leading to poorer health outcomes, avoidable hospital admissions, and increased strain on healthcare systems. This issue particularly affects patients with chronic conditions such as diabetes, hypertension, and heart failure, who require outpatient specialist care.
Triaging AI solutions already exist, but they leave important gaps. For example, it has been used to prioritize surgical waiting lists by predicting risk and outcomes, like the C2 AI's patient tracking list identifies patients at high risk while waiting for procedures. However, these tools are largely focused on surgery rather than outpatient conditions. Triage systems such as the Health Direct Australia can assess symptoms and direct patients to appropriate services. Studies have shown that AI triage system can reduce time to treatment, but these systems typically provide a one-time assessment rather than monitoring patients over time. Finally, remote patient monitoring platforms collect health information from patients at home, but this information is not always integrated into waiting list management and clinical prioritization processes. That's why our solution is an adaptive chronic care triage, where after primary care referral to specialists, patients inputs their health data into the AI system while on the waiting list, and the AI system continuously retriages the waiting list as needed as a dynamic triaging system. Patient would input or sync their self-measured data at home, such as blood pressure, glucose, weight, symptoms, medication use, and activities of daily living. The system would combine this with electronic health record data, where the patient's previous diagnosis and treatment were provided, and also contextual factors like age, comorbidities, language needs, and barriers to care. The system would then update each patient's risk score over time. And a traffic light dashboard would support clinicians, where green patients remain on routine follow-up, amber patients receive nurse review or self-management support, and red patients are escalated for earlier specialist review. This means that instead of relying only on the patient's condition at the time of referral, the system can detect deterioration during the waiting period and help clinicians to prioritize patients according to the current clinical need. More importantly, this is not an autonomous diagnostic system. AI would support, not replace, healthcare professionals, and clinicians would retain final authority over decisions about escalation, treatment, and specialist review.
What makes our solution special is that it targets the waiting list gap, the period between referral and specialist care, when chronic patients may deteriorate without being seen. Unlike symptom checkers, our system is longitudinal. It does not just access a patient once, it follows trends over time. Unlike surgical prioritization tools, it focuses on chronic outpatient care, where deterioration may be gradual and easy to miss. And unlike purely digital solution, it can include low-tech options such as SMSs, phone calls, and caregiver inputs, or community clinic uploads.
Our solution will benefit patients with chronic conditions who are waiting for specialist appointments, which can deteriorate over time, especially with little to no monitoring during this period. It will be especially valuable for patients in rural settings or equity deserving populations who often experience longer wait times and poor access. Healthcare professionals will also benefit by having access to more updated patient information, while healthcare systems can improve resource allocation by prioritizing patients whose conditions are worsening. Delivering the solution would require collaboration between multiple stakeholders. Patients would provide health data through the platform, while healthcare professionals would review AI-generated alerts. Software developers and AI engineers would build and maintain the platform, and healthcare administrators would oversee integration with electronic health records and waiting list processes.
The solution requires 5 core resources: an AI platform integrating machine learning, natural language process, and real-time data, a patient-facing interface, and large language model component to interpret free text reports, an ethical governance framework preserving clinical authority over all AI-generated recommendations, and clinical validation protocols, reliability against real-world outcomes.
Here we have outlined what we believe are three major barriers our solution faces. First, not all patients have access to smartphones or digital devices that can support an AI model. This causes an accessibility divide within the population. To address this, the platform would support multiple methods of participation, including SMS and telephone reporting. Second, AI accuracy will be imperfect during early development. Human oversight and continuous evaluation will be essential to maintain clinical safety and trust. All of this leads to the need for the last resource of clinical validation. This is needed before and during development to confirm that the tool risk scoring is reliable and its triage decision holds up against real-world outcomes. Finally, patient compliance may be inconsistent. Missed readings could result in missed deterioration. Automated reminders and alerts to healthcare teams when patients stop reporting could help address this barrier. Overall, adaptive intelligence can help create more inclusive and sustainable healthcare by continuously monitoring patients while they wait for specialist care, identifying deterioration earlier, and ensuring healthcare resources are directed to those who need them most. Rather than replacing clinicians, adaptive intelligence enhances decision-making, supports equitable access to care, and helps healthcare systems become more responsive, efficient, and patient-centered.